speaker, Dr. Jon Walker.
Anyway, I want to thank everyone for inviting me to talk. Let me get a little closer here. And I think it's amazing that people have pulled together to do something like this. It turns out that just recently, in my practice, we take care of vision-related problems, retinal diseases, and I was asked to see a premature baby that had a bad problem, and I called the hospital to go visit the baby, and unfortunately the baby had died. Now, there's a lot of reasons why babies can die, but in America, one of the big ones is that many times women, when they get pregnant, they can't get access to health care. And as you all know, the problem is not just limited to the suffering of mothers and babies. People get sicker in America, people die younger in America. In my practice, we see people that go blind that never ever should have gone blind, simply because they didn't have enough money to get an exam at the appropriate time. And it's not just the big issues, it's not just issues like people going blind or dying. If you do have insurance, you probably realize that something strange is happening, that co-pays are going up, deductibles are getting higher and higher. You have to go through a whole bunch of hoops just to see a different doctor, which makes no sense. There's no way that saves healthcare dollars. And all of these things mean, as you've heard, that America's healthcare system is bad. It's ranked number 37 by the World Health Organization. You've heard that number a few times, but what it means is they looked at not only healthcare. In America, if you have money, you can get excellent healthcare. But they looked at how fair it is, what everyone can get in the country, and that drops us way down to number 37. What, closer to the mic? Okay, thank you. People in other developed countries have changed that. They've decided that they want to be responsible for everyone, that they take care of everyone in the society, that government and the society itself will be responsible. And they've decided that healthcare really is a right. It's not a privilege for the rich. There's another interesting story that just came out. A man in Kansas, his wife was apparently very sick. She had a lot of brain damage, and he had no insurance. So he pushed her off the roof to kill her. It is obviously a sad story, but what's fascinating about it is if you go on the internet, you'll see that all the other developed countries really picked up on that story. They're fascinated by the kind of crazy things that go on in America with our healthcare system that we've almost come to accept as normal. And imagine what it would be like, for instance, to have universal coverage, as we're talking about. You have one card. You can go anywhere you want. You can see any doctor you need to. If you have a problem, you can get any treatment you need to. If you get sick, you don't have to worry about being sick and going bankrupt at the same time. Now, obviously, no system is perfect. All these places have things to work on as well. But all of those systems work better than ours. All of those systems take much better care of all their people. But nothing's going to happen unless we make it happen. As you've heard, there are very powerful forces that want to continue the way we have it here. They'll tell you that we really can work it out with private insurance. They'll say that these other national healthcare systems just don't work. But remember, all the other countries in the world, they're democracies. They could go back if they wanted to. They switched to a national health plan, and they never looked back. You don't see people from Japan or Germany coming to Fort Wayne to see how we do things in Matthew 25. You don't see people from Canada or Austria going to Indianapolis to ask Anthem and Blue Cross how to avoid taking care of sick people. Basically, those places are continuing the system as they like it. So, you know, as everyone has told you today, just try and stay involved. Get educated. Look at the websites on the pens that people are passing around. If you know a group that's interested in this, I know Edith Kenna is trying to put together a DVD that you can borrow, or I'm happy to go give a talk if I have time to discuss this, because I think it's very important. This really has to be a grassroots effort. No one's going to do this for us. No one's going to step in and make it happen. We have to make it happen. And hopefully someday every American can walk in and get the health care they need without needing to go bankrupt. Anyway, thank you very much for listening, and thank you all for coming.
Thank you.